Good morning. I think we're going to begin with Sarah this morning. We're going to take the Global Neighbors construction update this morning and then walk through that, and then we'll move on to the opioid and other policy issues. So, Sarah, you're in order.
All right, thank you. Just wanted to provide the board with a quick update. As you probably recall, this project's been in work for, what, a year or so far. What we have planned is for a space that we're calling Global Neighbors to operate out of the east side of the building at 1900 Carpenter. The plan has been that once we were finished with construction on the west side with Polk County Life Services, that we'd begin construction on the east side with Global Neighbors. And that, as a reminder, that project will serve as a central hub for ethnic-based community organizations to operate out of and provide services to their immigrant and refugee communities. I know there was a lot of discussion about it during the budget process in terms of staffing, but what we're talking about here today is just the construction piece of it. The construction will be not nearly as involved or complicated as what was happening on the west side of the building. It's primarily, just assembling offices, creating conference space, classroom space, getting some items up to code in terms of bathrooms, sprinklers, things like that. So a lot of the work will need to be done. I think the bulk of the work will need to be done regardless of what activity happens in that side of the building. But BBS is an architect who came in last year and helped facilitate a lot of the planning on how the space would get used. I know they presented to the board on the plan for how that space would be built out, and a budget had been set aside within general services to get that work complete. So this was just a very high level update for you all to let you know that the building has been completely gutted and general services is ready to get started on actual construction in that building. So just wanted to give you guys a really brief update and give you an opportunity to ask questions if you have any, but so that nobody's caught off guard seeing our folks in that building working and building.
Did I miss it, Sarah? Are we going to do all the work internally?
Or what? Yes. Yes. Yep.
Good. Glad to see it.
I know they were going to do some work at River Place, probably with the election office prior to formally diving all in on this, but
perfect. Thank you.
But that is the plan. Yep.
Any other questions? Okay. We'll go ahead and move on. Gabbie, are you ready to go? You don't need to stand if you don't.
No, trust me, I've been offered, but it's better for me to stand. I appreciate it so much.
Right. Thank you, Gabbie.
Yeah, so thank you all for being here this morning. We are going to briefly go over an update on opioid settlement projects. Supervisor Altringer, I have a print copy of the strategic plan. Always happy to go over that with you at a later point because a lot of this is derivative from that. So Annie and I are happy to answer questions about that at any time. I already spoke to Supervisor Holm this morning, just because some of this is a little bit of review for the supervisors. So first off, just some review. We have a separate pot of funds than what the state has for opioid settlement dollars. So while there's talk right now of what's going on at the state for our state funds, what we do at the county is separate, but of course we don't want to duplicate anything that the state is doing for the best use of our funds. And we have to spend our funds on remediation strategies to ameliorate the harms of the opioid epidemic, which basically means that we have to spend this money on evidence-based programs that help folks that have substance use disorders or co-occurring disorders. And we have a public-facing strategic plan that's posted on our website. It's been distributed with our community stakeholders as well as at Iowa HHS so that everyone is aware of the community-identified priority areas that we are focusing on for the first 2 years of expenditures. Currently, we have $9.9 million on hand, and we are projected to receive $32 million by FY40. These are numbers from the auditor's office, And we might receive more depending on pending opioid settlements. We just have to wait and see what the courts decide there.
Gabbie, do we have a certain amount we receive each year, or?
Yeah, so every year, we're receiving at least $2 million every year. I have to recalculate based on the most recent settlement that kind of came out of nowhere. Honestly, we don't get a lot of notice as to when we are going to get payments. We just know that in X fiscal year, we are getting funds from whatever company has settled with the national opioid settlements. And that is also in the strategic plan a breakdown, although I do need to update it. Overall, our philosophy for the funds is to invest in startup costs for sustainable programs. These are one-time funds, even though we're getting them over a long period of time. So we're looking at any program that we know can be self-sustaining at some point, or startup costs. So we're not really looking to do ongoing administrative costs for an organization, for example. We want to be able to set people up for success, because once these funds run out, they're gone. So I'm going to get into this a little bit more here in the following slides. But why we're here today is because I would like to give you the opportunity to ask any questions about programs that we would like to see start yet this fiscal year, as well as programs we would like to see start right away in fiscal year 26. And ultimately, this all aligns with the budget that Annie presented for BHDS. Gosh, I guess it was last month already. And then we are able to look forward and see that essentially what was laid out in the budget is going to be accurate, plus a little bit extra money that we thought we would spend this fiscal year, but it's over the 2 years, we'll end up spending the same amount. It'll just be a little bit more in fiscal year 26 versus 25. So the first expenditure here, program that is directly from stakeholder input. This is a group of people that range from criminal justice to treatment to people with lived experience. Is housing is such a huge issue in our community, and we do have an opportunity to fund recovery housing with the settlement dollars. However, we know that housing is a pretty expensive expenditure, and so to get creative and still honor what our stakeholders want, we came up with an idea of a temporary housing assistance program that is not duplicative of other programs. It would be a funding of last resort to help people be encouraged to go into substance use disorder treatment. So it would fund their rent while they are in an inpatient program, and it is essentially eliminating a barrier to care. And so the stakeholders thought $1 million was a good amount to spend on housing, enough that we could make a difference without going overboard or being duplicative of what the state is doing.
How many people would that, are you looking at?
Yeah, so if we're looking at how many folks, we thought roughly 200. So if we are looking at roughly 2 months of rent, and average rent, I don't have in front of me, we calculated out. So if we think about stretching the dollars as far as possible, if these folks were to enter treatment and then lose their housing, then go into the housing system, housing continuum, maybe need permanent supportive housing, this is a good investment of dollars, because instead of directing them to a system that's already overloaded, we can create stability and keep them in the housing they already have, versus further stress a system that's already stressed. And you're free to stop me for questions at any time. I'm just going to keep plowing ahead here. The next program that we'd like to get started as soon as possible is an overdose response team in coordination with the Des Moines Fire Department and Full Circle Recovery Community Center. This is a proposal to respond to folks that have had an overdose and go back to their home and provide services in their home and connecting them to treatment and recovery services and giving them medications right away in their home very quickly after the overdose occurred. This model has been replicated across the country. We have close ties to a model in San Antonio. We know that there's a great need for post-overdose response, and these two organizations are happy to serve the entire county, not just Des Moines, and provide post-overdose care for those folks that didn't experience a fatal overdose but need that help.
Gabbie,
Yes.
interesting point you just made. These two programs are willing to serve the whole county. Are all the programs, or are there some programs that aren't willing to serve the whole county?
No, when I say programs, I mean that Des Moines Fire Department, of course, has their jurisdiction. They're willing to go for the whole
I see what
county.
you're saying.
Yeah, but treatment programs, of course, serve
Okay.
the entire county, whoever wants to come to them.
So the housing one would be the entire.
Yeah, so everything we're talking about here is Polk County. So these are our dollars. We're making sure that everyone has accessibility to the programs.
I know initially when this was proposed, it looked like it would only cover Des Moines for the EMS recovery, and that was something that I know Supervisor Altringer wanted to see if that could be expanded, and that's what you did. You went into that. Was there an expense side to this that changed as a result of going from citywide to countywide, or no?
Nope, it'll just be an agreement between all of the EMS that they're able to share that information to this team, and then they'll respond even if a different jurisdiction responded to the initial overdose. This team will go and respond and provide that connection to care.
Okay, thank you.
Absolutely. The next thing that now we're getting into fiscal year 26, but of course we need to do the prep work now, is a continuation of a grant program that was very successful in its first iteration, but now I would like to pose to the grant again. And these are a general grant called Supports for People with Lived Experience. The last cycle of grantees, I actually got an update late last night, reached 1,300 people, not 1,100 people, in each of their first 3 months of implementation, and we're much further into it now. This is just from the reports that I've received. So highly successful in reaching people for treatment and recovery services. And this is a 2-year grant where organizations receive $100,000 per year, $200,000 total, so that they have the opportunity to plan for the future instead of a short-term grant where everyone's scrambling and then maybe not getting everything done that needs to get done. 2 years gives them that opportunity to build for the future and be sustainable like we want them to. And this is an application process for any community organization that has an idea of how they can support people with a substance use disorder, engage them in treatment, reduce harms of their substance use. It's really giving the community a chance to tell us what they think the community needs and what people with lived experience tell us. And so it's been highly successful so far, and we just want to put out another funding cycle for it. The next grant opportunity is for youth prevention. So we would like to give an opportunity to organizations that are interested in specifically 4th to 8th grade programs. That's what the research shows is most successful from preventing people from using substances in the first place, as well as providing them technical assistance to help those organizations strengthen and grow. We have a lot of great providers in our community that want to expand into other programs, but maybe they don't have the support from the professional side to do that type of work. And so as a part of this grant, we would contract with the Prevention Science Collaborative at ISU, and they would provide that TA to strengthen those organizations. And then we would also provide a separate training opportunity for pediatric providers to better identify and treat problem behaviors in youth, which is the main long-term effect of neonatal substance exposure. And that is a core expenditure area for the national opioid settlements, is looking at neonatal abstinence syndrome and helping kids that have been exposed to substances. And so we're just dipping our toes into this, but we did a similar program for youth mental health that was highly successful in training those primary care providers, because we might not have the specialists, but these primary care providers want to step up and provide that care. And so this is an opportunity to give them the training to do so. The next thing I have here is overdose prevention efforts. So we currently are funding 2 organizations to do this work through harm reduction grants, and one of these organizations has gone above and beyond, and I would like to offer them an extension to expand the work they're already doing. Steps of Hope Iowa provides prevention education and overdose prevention supplies such as Naloxone. If you've been around the county and see the Naloxone boxes where anyone can go and grab the Naloxone, that's them. They're the ones that are placing those boxes as well as filling them. And they were able to place 18 boxes just since August with the funds we gave them, and distribute 3,000 doses of Naloxone. And they also have pursued other funding streams, so they're showing that sustainability piece, that they don't want to just rely on us for funding. And this would give them the ability to expand as an organization and further the good work they're doing. And the second piece of overdose prevention efforts would be a partnership with the health department to expand their health vending machine initiative. They are looking at contracting to have a grant-funded vending machine with health supplies, and the overlap with opioid settlement dollars is that they have overdose prevention things such as Naloxone in that vending machine. And so once they have a successful model, we'll duplicate it with the settlement funds and potentially have that vending machine at another county building. And then the next thing that we want to get started right away in fiscal year 26 are 2 programs that have been in the works with the Sheriff's Office and have the full support of Sheriff Schneider as well as Chief Williams over at the jail. And the first is a reentry kiosk with St. Vincent de Paul. So we have half of our jail population in and out within 24 hours of booking. And so there's a lot of opportunity to reach them with services, and we know a lot of those small, or I should say, low-level charges, a lot of that has to do with substance use disorder, and so this kiosk would be a place where people coming out can receive services, potentially be connected to treatment, great programs like immersion that St. Vincent de Paul runs, and we would be able to use settlement dollars to get that kiosk off the ground. The second program at the jail is medication-assisted treatment expansion. So this is medications for opioid use disorder. It's the gold standard of treatment for opioid use disorder, highly effective in reducing recidivism, criminal activity, and most importantly, it does save lives, even if someone's on a medication for a short amount of time. But the goal would be to connect people to outside treatment so that when they leave, there's a continuation of care. And we are applying for grants for both of these projects. Of course, pending what happens at the federal level with some of these grants, it might delay the timeline. So we would rely on settlement dollars to kick things off, and then keep applying for grants as they're reposted on federal websites.
Gabbie, I met with St. Vincent de Paul. Steve and I chatted a little bit about the kiosk system. Is the primary pilot for 26-27 the reason that's taking so long to implement is you have to create the kiosk and the technology that's going to go into it? So
yeah, so it would involve a slight remodel of the jail lobby area, but it would be very minimal, and then it would require a staff member. And so we were pursuing grant funds, and then things have changed, and so we were hoping to rely solely on those grant funds, but now we're shifting gears to just get things started with the settlement funds. So that's a part of the delay.
okay, it's my understanding then the kiosk is going to help partner individuals that are in a bad way with services as they re-enter life. So
Absolutely.
so the types of things that will be offered to them through the kiosk are help with housing, help with treatment, help with jobs, and other challenges with reentry. Is that correct?
Yeah, absolutely. Addressing the social determinants of health and factors that might have led to the activities that got them in jail so that they don't come back to the jail is essentially the overarching goal.
Got it.
Gabbie, as far as the collaboration or coordination, has this all been shared with the Criminal Justice Coordinating Council? The reason that I ask is that so that we don't have any duplications, that a lot of these same types of discussions and questions come up at the Criminal Justice Coordinating Council. So I just hope that they're engaged at some level, so we're not asking the same questions over and over again at those meetings, because you get those questions from other jurisdictions.
Yeah, absolutely. So hopefully with your blessing as we move forward, the next step would be to present briefly to everyone there.
Good.
Of course, the key stakeholders involved in the jail are already well aware of what's going on with these programs, but yeah, absolutely. These are the same things we're working on, and I'm on the Behavioral Health Subcommittee of the CJCC, and so there's some communication going there, of course, with Jerry.
Glad to hear. Thank you.
Absolutely. And then as we're looking even more forward, just because there's a lot of preliminary work that needs to happen, this is something that Annie mentioned in the budget discussions, that in FY26 we want to move forward with creation of a pre-arrest deflection and diversion program. So essentially, this would be law enforcement led, so let's take trespassing, for example. Instead of taking somebody to the jail for trespassing, they enter a program where they're able to, similar to the kiosk, address maybe underlying issues that led to them having that trespassing charge or being in that situation, and then having case management to help that person hopefully not reoffend at some point. And so this has had cross-sector support within our criminal justice community. The Polk County Attorney's Office applied for a grant for this, and unfortunately we didn't get it, but we will continue to apply for outside funding. And the cost estimates are from the Technical Assistance Bureau for the evidence-based model that we would like to pursue. And so we would have that support implementing this program, first starting small and then scaling up as all the kinks are worked out. So as I said, very preliminary stages of this program, but something that I want that for you to have on your radar as one of our goals for the next fiscal year. Any questions about any of what I've said so far?
Gabbie, just want to know how you're going to measure everything as it relates to the success and efficacy of the work that you're doing.
Yeah, absolutely. So data collection will be crucial to all of the programs that we implement, and our current grantees are required to collect data such as how many folks they're serving, and they all were required to set their own goals and metrics. But when we're looking at things like the medication-assisted treatment at the jail, for example, there are national metrics that we can look to make sure that we are implementing from the beginning, so that when we're going for some bigger pots of money at the federal level, we already have the data ready to apply for those funding streams. So it really depends on what the program is, but we're able to look at other models as well as set our own metrics, because when it comes to reporting for the settlement dollars, it's really up to us what we decide to collect data on. So if that's something you're interested in, I'm happy to talk about that further.
So do you anticipate that you'll be able to draw down state dollars that are directed towards opioid settlement programs with these dollars?
It's hard to say. The state right now, there's one bill unless another has come out since I last checked, just about how the funds will be administered. So that means that we would be waiting another session before the funds would even be expended. And at that point, based on what happened last year in the legislature, I anticipate that they will be funding prevention, treatment, and recovery related programs. And so we're taking a little bit of a step back from some of those things, because I want to see what the state does and see how our community organizations can draw down on those funds. So to answer your question, yes, we want to draw down on those funds, but we don't know what they're spending them on yet.
Okay.
And then very quickly, if you ever want to see updates of what our grantees are doing on the Polk County website, if you go to BHDS and then opioid settlement funds, I post updates from our grantees, any grant opportunities that you might want to send to community stakeholders, and the strategic plan all live on that webpage. So that concludes my information about the settlement projects. And so now I will shift gears into talking about the naloxone policy. And while I am focused on opioid settlement funds at BHDS, this is a completely separate thing. So if we can try to turn our brains off of the settlement dollars and then go to something that involves a county policy that we've been working on, that would be great, just to avoid some confusion. So I printed off this sheet that has bullets, just instead of going through the policy paragraph by paragraph. It's something that was set on your desk before the meeting. Yeah, no, you're fine. And just to make it a little bit easier, and I have Andrea and Rodney here who are key partners on the creation of this policy. So a little bit of background for our new supervisors here. Excuse me. Last year, I presented on creating a naloxone policy for the county employees. And the reason is that overdose happens in county spaces and public spaces. We actually had an overdose happen at River Place a few months ago. And having naloxone or Narcan, the opioid overdose reversal drug, on hand is a way that folks can respond to an overdose when death can happen in minutes. Sometimes it's not enough to wait for the EMS. It's too late at that point. And many county departments have requested training and to have naloxone available. So at that point, after the board requested we move forward, I worked with Andrea and Rodney in risk management in the Polk County Attorney's Office to create a sound policy to have on hand. And what's included in the policy is basically that naloxone use is optional for county employees. So if someone saw an overdose, they would not be required to respond. They would have choice. Then having the proper use of naloxone, reporting guidelines. If a county employee did use it, they would have to report to the naloxone coordinator, who will be Rodney, that happened, so we have record of that. And then also the coordination of the stock, so some of the logistics. Those are the key components of the policy. And so for actually implementing this policy, essentially, we would have the naloxone in our AED machines, as you can see in that photo there. That's what it would eventually look like, where it's enclosed in a pouch, and there would be a sticker saying that an overdose emergency kit is inside. And Rodney would work with General Services to have those kits inspected. We're required to have our AED machines inspected periodically. So when I say inspected, it would be to look and see if it's there and then report to Rodney if it's not there. We also would require a training component for county employees to have access to. So for those that are already employed by Polk County, we would offer a lunch and learn or two, as well as an online training. And then the online training would be used moving forward. That would have a very basic how to use naloxone and a very basic overview of our policy, just making sure people know they need to report. Optional distribution, there's also a clause in the policy that county employees would be able to distribute naloxone to the public for free through an HHS program. So this is just another thing in our policy related to naloxone. So we're mostly talking about county employees administering the naloxone, but then there's also a clause that we would be able to hand this out for free. For example, at the health department, if someone came in and asked for it, we would be able to give it to them. And that leads into, what I know all supervisors love to talk about are the costs of programs. So All of the naloxone that we received from the state, we would receive from the state for free. So both for what we stock in our AED machines as well as what we would give to the public. These are long-lasting state-funded programs where we order the naloxone from the state at no charge and could reorder as much as we needed. There is a one-time cost to buy the stickers and the pouches. It's something we looked into pretty extensively to find something cost-effective that also would catch people's eye. And that would run us about $1,500 to have the CPR masks as well as those bags and supplies. And that could come directly out of settlement funds. That is an approved use, naloxone, to prevent overdose. And then there might be some minimal ongoing costs to replace the bags if someone took one, or CPR masks if they are used, and that wouldn't be more than $50 a year, which could also come out of the opioid settlement funds. So happy to answer any questions, and also have Andrea and Rodney here as well. If you would like to pass a question on to them, I'm sure they would love that.
Yep, it's my understanding that we're already doing some distribution of Narcan at the health department. Is that?
Yeah, so they're getting theirs through a separate funding source. So this line in the policy is related to the HHS program. So it's just to make sure that we're following any reporting guidelines that HHS wants us to do for the stock that they give us. But you are correct that they're getting free Narcan through a separate funding stream and handing it out because it's over the counter and they're able to do so with no risk.
And it's my understanding that the public is aware that we are a provider of the free Narcan for the public through the health department, so they know to get in contact with the health department. And how is that being noticed to the public is what I'm trying to ask.
Yeah, so there hasn't been widespread public notice of it, I would say, until we formalize and have some better, we have the policy in place and that type of thing. There is a hub of, what should I say, like a resource or a location map or database, there we go, that's the word I was looking for, through HHS that people can access in this website called naloxoneiowa.org. But if we were to move forward with this, we would certainly engage all of our stakeholders that we do through the opioid settlement programs. Health department has a lot of networks to further publicize this once we're prepared to have a larger stock at hand and make sure that the public does know, because we, even though it is over the counter, we still are not at a true saturation of this medication to reduce the amount of overdoses in our county or across our state. So anything we can do is positive.
So what buildings will this be in when it's fully implemented?
So it will be anywhere that we have an AED machine. So there are some sites that county employees work at that it's not a county building, that they would have it with the AED machine that's supplied there. We also have, I think just the Mine Task Force is the only county building that wouldn't have it since they already have their own. But it would be at essentially all county buildings, anywhere there's an AED. So conservation kind of has some floating around as well in their vehicles. A lot of places, all the buildings.
I can also add is that every county building has an AED, minimum of one, some have multiple, so we should be covering all of them.
Thanks, Rodney.
Matt, I have a question on this.
Yeah, go ahead, Don. Yeah.
Is that what, are the employees going to be covered under this?
So,
How
So, yeah,
implementing this?
so, first of all, in the education that I've had with Gabbie and then otherwise in researching this policy, it's the kind of drug that really you can't harm someone with, even if they are not having an overdose, related to opiates at that time. All that being considered, Iowa Code Chapter 135 does have within it liability protections for both individuals and organizations that shield them from any kind of potential liability if some harm were to come to that individual.
I figured that, but I just want, I'm gonna get that question at some point. I knew someone's gonna get that question.
I asked the same question, Don, because that occurred to me as well. So I think you're right on track with that. And I think that's one of the things that we hope to provide with the training as we roll it out. But it does appear that they would be covered under Chapter 135.
And to add to that, we have AED machines all over the county, and while not everybody is trained, we do have representatives from every department, correct? That are trained on how to use those, and so those county employees are not obligated to use the AED machine. However, it is there and it's used to save lives. And I think of it in the same regard that naloxone is there, we're able to use it, but that's a good analogy that I like to employ.
So what's the timeline for the implementation then on this policy?
Yeah, so we have everything ready to go. We'd be able to get the reporting form up, order the naloxone as soon as possible, and I anticipate that it would be probably about a month before HHS would send us everything. We'd have everything on hand, and at the same time, we would be getting this ready to go in front of you as a resolution. So hopefully we would be able to see the naloxone in the buildings, I would hope in 6 weeks, but of course, we are reliant on when the state sends us the supplies, so I can't say for sure.
Do you know if the state has fully implemented their policy as it relates to this in state buildings, or do you, any idea where they are on the process?
My understanding is that they do not have a policy related to this. I can look into that and get back to
I know they
you.
wanted to get these out at road stops. DOT, we're looking at that as well, so.
Okay.
But
Yeah, no, I can
I've
check.
kind of lost track of where they are. I usually try to track that a little bit, but this is great. I think it's a great policy, and from my perspective, if we save a life, any life, in any of our buildings, it's a good thing to have, and appreciate the work that's gone into this on behalf of the department and Rodney and his team as well. And I think this is another tool that people will have out there, and I'm particularly interested in families that know they have individuals that are high risk for needing this, that they have access to this at the health department, and that the health department is identified as a key place for individuals and families to go to pick this up as well, so.
Yeah, absolutely. Yeah, I appreciate your time, we appreciate your time, and of course, you're welcome to reach out to Annie or myself with any questions at any time about the settlement or the policy.
Great, thank you. Annie wanted me to let everyone know that she is at a behavioral health conference in DC, and she would have been here, but she wanted this policy implemented. She also wanted the rollout of these potential grant programs to be identified for the board, so that we see the direction they're going before we get much later into spring. So
Yeah.
she wanted us to move forward with that. So hopefully she's having a good conference, and we thank you for your presentation today, Gabbie and team. Thank you very much. And I think that concludes our board staff discussion items today. And At this time, I believe that we will, are we going to do the closed session at 9:30 or? Yeah, so we have time, I think, for a break and then we'll be back at 9:30 for a closed session.